This morning, it's my great privilege and joy to welcome a special guest, a member of St. John's for over 30 years. In fact, his family kind of grew up there. I've seen his children come through our programs, and Dr. George Rutherford is a professor of epidemiology at UCSF. He has been very active and prominent in disease control, having worked on the Ebola virus, Zika virus, HIV, and he runs a lot of the press interface for UCSF. And his wife, Mary, is also at Children's Hospital, UCSF. I think is she in the emergency room that she works?
Thankfully, she's gotten a little long in the tooth for that. So she, after running the ED for 30 years, she's now doing patient safety and quality.
Okay. Well, thank you for being part of this. I'm sure everybody is very interested in what you have to say. First of all, how are you, especially as physicians, having a physician's house, kind of coping with the current epidemic?
Well, there's not a lot, I basically work on this full time, and it's taken, it's all consuming. And so it's a ton for me. Mary's still going to work at the hospital, comes back and forth, and, we get to decompress a tiny bit every night, but, basically my days start at 4 a.m. and end at midnight. So it's, it's like being in a war right now for me.
I can't imagine. When I'm sure you get asked millions of questions. What are some of the questions that you've been answering out there? What's on people's minds as they approach you and the press approaches you for answers?
Well, it's like, you can imagine it's all the gamut from, is my dog safe to, up to real like big, meta questions. I think the big question right now, if I were going to ask one question, is there light at the end of the tunnel? And I think the answer to that is yes. There is remarkable data that has just come from two provinces in Italy. I want to say Lodi, but it must be pronounced Lodi in Italian, and Bergamo, which are adjacent to each other in Lombardy, near Milano. One of them, Lodi, began what we're doing, shelter in place, promptly. And I think we could say, yeah, we could have done it maybe a few days early, but it was plenty prompt compared to everybody else. Whereas Bergamo waited and screwed around for a couple of weeks. The peaks, the current incidence is like this. It's hugely different. And it's probably 5 times higher in Bergamo than it is in Lodi, where they did shelter in place early. Mm-hmm. That's one of the most favorable things we can see. Additionally, in China, there were no new cases in China today that had not been imported, mostly from Italy, interestingly. And there are a really rapid decline in cases in South Korea that's had massive disease control programs following a large outbreak with 8,000 cases. So that's where we are worldwide. Europe is a colossal mess. There are more cases now in Europe than there have been in China. And the medical care systems there are really straining to keep up. There is this concept in emergency medicine called austere care. It's sort of battlefield care. It's, if you have 2 people and you have to choose between them, how do you choose between them? Who's more likely to survive? Who's more likely to benefit? It hasn't quite gotten that far yet in Italy, but it's at the verge of that. So it's, and everybody's sort of pulled back among themselves. In the Schengen countries, the 26 Schengen countries, they put up border controls now. There's, so there's a huge line of cars going back and forth between, so it's a 16-hour wait to get from Austria to Hungary today. It just, it's brutal. And we're trying to move stuff around. We have to move medical supplies around. Not everybody manufactures their own medical supplies, and you have to move medical supplies around. You have to move drug around. You have to move stuff around. And I have a feeling that poor Italy's being kind of left on its own because France, Germany, and Spain are all struggling as well.
Hmm. And so, you feel when you talk about light at the end of the tunnel, you feel we're being pretty proactive comparably.
Oh yeah, we're way out in front,
Mm-hmm.
even compared to the rest of the country. We're starting this way before. So the first case in San Francisco was on, I believe, March 3rd. No, that's more later than that. So say it probably was infected on March 3rd, presented on March 8th. In Santa Clara County, person was probably infected on around February 29th. So that's the sort of time frame we're dealing with. So even at the longest that we let it ride for 2 to 3 weeks before putting these kinds of controls into place. In China, it took at least 5 weeks before the controls were put into place. So it's it's a very different kind. We're way out in front of the curve. And the Bay Area counties that have done this, I think, are going to reap the benefit here soon. Now, in the places where I usually work, like Malawi and places like that, this is going to be a big, 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 big mess. We're not quite sure about transmission in sort of in kind of the equatorial belt. Influenza and most respiratory viruses don't transmit very well in those places because people are outside a lot. But we'll have to see. There's current, spread both in Australia and local spread both in Australia and South Africa and Brazil, now that I think about it. So it's not like being in the summertime is an instant get out of jail free card, despite what you've heard from the administration from time to time. And so it's, but we'll have to see how it goes in low income countries, because it could be a real big mess there. But it's going to come and go pretty quickly, I suspect.
When you talk about being outdoors as a slower environment for the spread, I think it was yesterday, the report came out that, droplets can exist for 3 hours or something to that effect in the air. It makes people wonder, is it even safe to go outside sometimes, or even whether 6 feet is far enough from another person?
Yeah, well, that report it wasn't disinformation, but you have to understand that was done under perfect laboratory conditions to try and set a far edge of what might be possible. If the disease could last the organism could last that long hanging, sort of suspended in breathing zones, you'd see 1.4 billion cases in China, not 70,000. So it's not consistent with the data that we know pretty damned well. I guess I shouldn't say damned on this, but pretty well. So I'm, that's, it's not disinformation, but it's unhelpful. And of course, it was picked up instantly by the press.
Right. Well, I think that's how wonderful for you to take the time to talk to us about this, because I think there is a lot of fear, and perhaps at least the fear maybe makes people take it more seriously, but it's helpful to know the facts.
Yeah.
As we move forward.
Unfortunately, there's a lot of nonchalance as well,
Mm-hmm.
especially among 20 and 30-year-olds. The U.S. First big U.S. case series came out yesterday, the day before, and it clearly showed that there was disease among 20 and 30-year-olds, and even among children. Now, it's not as much, it's not as severe, but these are basically people who end up getting hospitalized. And there are patients that I know of who are in their very early 40s who are in intensive care units here on the West Coast, and with big time disease, like lung transplant needed kinds of disease. So it's not, you don't have a complete get out of jail free card just by the virtue of the fact that you were born after 1990.
Right. And of course, there we're all responsible for each other. Just because someone escapes, it doesn't mean they can't transmit it to somebody else as
There's
well.
quite a bit of asymptomatic and mildly symptomatic transmission that
Mhm.
people can, and that's one of the other lessons we're starting to learn now from China as they put the data together, that there's a substantial amount of people, especially before these kind of shelter-in-place programs, who are transmitting, who really don't have recognizable disease. Certainly not kind of the classic triad of fever, cough, and shortness of breath.
Right.
China has thought that that might represent maybe even 80% of the transmissions before people got locked down, which is important. And so I would say to people, if you're sick, don't go outside. Just don't. All right. Have somebody else bring you your stuff. Get DoorDash. Do whatever you want. Get Netflix. Enjoy yourselves. It's a vacation. All right. Don't go outside. If you have to go seek medical care, call ahead, because they're going to want to segregate you off, and they're going to want you to go to a special place. Among the other things we don't have enough of is we don't have nearly enough healthcare workers to take care of all the people who could potentially come. And so they're a commodity. We are a commodity just as well. And having people wandering around outpatient clinics who turned out to be infectious just ends up with lots of people having to get quarantined who we need. So call ahead, follow their instructions, go to the places where they can screen you in a safe way.
So as we try to help, especially the vulnerable that we know in our community, offering to run errands for them, grocery shop, etc. What recommendations would you offer to those of us that are going to run those errands? I would imagine, first of all, just dropping it off on the doorstep, not interacting with people who are vulnerable. What other precautions should we take?
Well, I'm also concerned about you.
Mhm.
Having been at 3 Safeways last Saturday, just kind of idle curiosity. It looked like the arrivals terminal at O'Hare Airport on Sunday. It was a
Right.
mob scene.
Yep.
If you're going into those places, I mean, Scott, you're not. I mean, I realize you're younger than I am, but you're not that much younger than I am. And I would be careful myself. And I think there's this wonderful idea, this great idea that some of the grocers are putting together in San Francisco to have a seniors only hour at the start of the day for the grocery store, so you don't have to interact with everybody yanking their kids around by the arms, and and everybody hasn't touched all the food yet on the shelves, and I think it's a great idea, and the densities are much lower too.
Yeah.
So
I had an experience that I was very impressed with. Uh, I did have to go out and get some supplies, and I was over at Trader Joe's in Alameda, and but here's what they were doing. They were everybody outside in line. They were spaced, 6 feet apart, and it looked like there was going to be a long line there. But what they were doing was, first of all, they wouldn't allow anybody to take a cart in that they hadn't personally disinfected. They had a team disinfecting carts.
mm-hmm.
When you got inside, virtually no one was inside.
Mm-hmm.
So the spacing was
Sounds like the Matterhorn ride or something. Yeah.
and then there was absolutely no wait in line. They always had 1 or 2 people available so that people were not standing behind each other. So even though there was this line outside, there was this sense of at least an attempt to space people.
Yeah. Well,
So
I mean, that's the sort of stuff that will persist beyond the shelter-in-place orders.
mhm.
I mean, I think there's a lot of I think there's a lot of other stuff that will continue beyond. And someone said to me, "Oh, it's like the save water orders during droughts." So we don't flush toilets, so everybody in Los Angeles can wash their cars twice a day. to make sure the water gets where it needs to be.
Right.
That some of the lessons, like we've learned from saving water, will persist beyond this, and hopefully we'll have a little bit of we'll have a little bit of kind of carry forward of these social distancing behaviors.
How do these, when you look at the graph and your experience with watching these outbreaks, and what does that curve look like for you? I mean, I know we're never going to get back to the way things were. I mean, I think it's changing us in perhaps a good way. But I know we keep pushing the date further and further out. We're going to miss Easter, gatherings this year, for sure. And we're going to, do what we can to keep people connected. But how do you see us moving back to moving about in society? What do you think that timeline might look like?
I think personally, I think it'll probably be late spring, early summer. The pessimists say, yeah, it'll be late spring or early summer next year. A year from now, and I don't buy that. People have made these outlandish projections based on sort of pure mathematics, which, although they motivated the federal government to start doing something besides deny, I think they also do a disservice in making everybody crazy.
Right.
And we're trying to make right-sized estimates and stuff. So it's, I would hope that we could kind of get beyond this stage by late spring, early summer. Now, the other thing to realize is that it may well come back in the fall. So we have to be prepared to think about the fall as well. So I need to get rocking. I'm sorry.
No, that's fine. I just would like to thank you for joining us, and I'd like to close actually with a prayer for nurses and doctors that was actually composed during the Ebola virus. Sanctify, O Lord, those whom you have called to the study and practice of the arts of healing, and to the prevention of disease and pain. Strengthen them by your life-giving spirit, that by their ministries the health of the community may be promoted and your creation glorified, through Christ our Lord. Amen. Thank you again, George. I appreciate you taking the time.
Anytime, pal. Take care.
You too.
Bye-bye. Good luck, everybody out there in TV land.